Well, I think the one way we broach it is that we just normalize it. Because we know that these are really important topics to discuss and to evaluate during the adolescent years. We do it with all of our patients, we do it consistently, and we do it to sort of standards. Well, my visits are not painful. My visits are really just chatting. I tend to do a pretty thorough history and physical, more focus on the history portion. So I talk to patients in a way that assumes they'll talk back. They'll communicate effectively. You know, if I feel like the one thing with teens, if you give them the respect and the openness to talk about their health, they often will become very engaged and be honest and work with you to keep them healthy. We talk about their history. We learn, sometimes teens don't know their own past medical history or family history, so we kind of go through that and then focus a little bit more in detail on what they are coming, specifically to talk about. But the one aspect that we always do every visit is a biopsychosocial history. So this is really focusing on what are the aspects of the teen's life that can make him or her at higher risk for challenging health consequences. So we always talk about sexual activity or substance use and things like that. We offer confidential care, which generally means at least a portion of every visit, if not the whole visit, is done with just the provider and the patient in the room and the parent, out of the room. And that allows the teen to kind of have a private conversation about their health care with their provider, which is really important. For the provider's standpoint, to kind of assess some of these more sensitive topics and gives them a little bit of privacy and trust to disclose some things they might not want to disclose if their parents were around. And on the flip side, I think it also is important for the teen, because one of my roles as an adolescent provider is to help the teen learn how to become an adult and how to become manager of their own health care, after the age of 18. So if having these little conversations during their adolescence about their health with their providers, they can learn, have these conversations, take a little bit more responsibility. I mean, with teenagers, it tends to be a bit tricky. I feel like that navigation between provider, patient, and parent relationship is important throughout the pediatric lifespan. I think when they're younger, of course, the primary relationship is between the provider and the parent, with the kid being kind of the focus of the care, but not really a participant. During the adolescent years, that has to start changing to allow the teen to become a little bit more engaged. So again, we do this through confidential care. At least part of the care is confidential. The one thing that I do try to focus and talk about with my families is that we always encourage open communication. I don't want to be a secret keeper. There's some things that, because of ethical or legal reasons, I can't disclose to families. I still want them to be part of the picture. And I encourage my parents and my teens to talk to each other and kind of keep that, or at least work on open communication, which can be a little bit challenging. But parents are often a very integral part of their teens' healthcare, even up until later adolescence, so it's very important.